I've never scrambled on a case with Dr. Elder before. Do you think he'll let me do some suturing? It seems like a pretty straightforward hernia.
Yeah, his cases are pretty straightforward from what I've seen the past few years. I mean, he has his routines, but they say he put down the landing gear a few years ago. Now he's just coasting towards retirement.
Retirement? Do you really think he's that old?
Yeah, I mean, after 50, does it really matter?
Hey, Bob. Glad to
Hey,
see you
Art.
made it in this morning. You know, missed you on the weekend.
Yeah, I couldn't make it. My hip was really acting up.
Really? Well, it was kind of miserable. They put one of those new members in, and guy talked my ear off for 4 hours and beat me by 5 strokes.
Well, I went to the clinic on the weekend, and I got Jim to inject it, so I should be pretty good for Saturday. I'm looking forward to continuing our 20-year tee-off times.
Yeah, that's a good old tradition. All right, guys, time for the timeout. I guess they just don't trust us surgeons like they used to. This is Mr. Smith. We're going to fix a right inguinal hernia, and by right, I mean the right side. Not allergic, not on blood thinners.
But Dr. Elder, the patient did say he was on a blood thinner. Are you sure?
Oh, yeah. He's on River something, one of those new thinners, new one out every week. My secretary picks these things up. I'm pretty sure she would have stopped it.
The patient said he was on something. He said he stopped it yesterday or last week. I don't know. It doesn't matter to me because I'm not doing the block. But, you know, Thrombo's putting people on this stuff all the time. And when I see them in the clinic, I just send them back to Thrombo. They can handle it. See how the surgery goes. If he starts to look a little bit bloody, let me know. I'll hang a bag.
All right, good enough for me. Let's get going, guys. The sooner we start, the sooner we all go home.
This is a really interesting way to repair a hernia. Never actually seen it. Only read about it in the books.
Well, young man, it's not just interesting, it's the only way. I learned this repair from Dr. Osler when I was a resident, and I've been doing it the same way ever since.
Dr. Newhire says that this new mesh plug way is faster, better for the patients, and just overall better.
Yeah, I thought they reviewed that evidence at the last journal club. I thought they concluded that the mesh plug was the standard of care.
Well, you know, the standard of care in my room is my repair, and if it works for me, it works for my patient.
Oh, I'm sorry, Dr. Elder. I didn't mean to...
You know what? Ever since New Hire came on, it's all about the evidence, all about the evidence, him and his fancy degree. I'll tell you, what's evident is he forgot who trained him, and he certainly forgot who hired him.
Art, I know what it's like. We got guys in our department like that as well. Always wanting to bring in new stuff. Whatever happened is keeping it simple. Thiosucks tube. Give me the old days anytime.
Well, you know, it's just not the place that we came to all those years back, Bob. You know, it's miserable. I just wonder, I need a few more years here, top up the RSP, and then I'm out of here.
Oh, I wish I could do that. Stock market just crashed. Cottage needs repair. Kids getting married. Wife wants to travel. I'm going to be working forever.
Yeah, I hear you. Well, that's good enough for me. You guys take care of the orders and close them up here. I'm going to go in the lounge, put my feet up, all right?
Well, that was awkward. He pretty much did the whole case. What's up next?
Yes, same old, same old.
Well, then do you mind if I go do some reading?
Yeah, man, go ahead. Not much to do here. I'll stick it out. Somebody's got to hold the retractors. I'll see you tomorrow for new hires list.
That's great. I love working with Dr. Newhire. I guess I'm going to go practice my tying.
Sure.